Hi, and welcome back to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Yemi Famuyiwa. She's a fertility specialist and founder of the Montgomery Fertility Center. Today's Kevin MD article is The Hidden Impact of Pharmacy Benefit Companies on Fertility Treatments. Yemi, welcome back to the show.
Thank you. Thank you for having me.
So we're going to talk today about pharmacy benefit companies and its impact on fertility treatments. Before talking
Yes.
about this article, what led you to write it in the first place?
So curiosity, patients always coming back to me trying to find out. I think it's a whole smorgasbord of what's going on with the pharmacy world with patients. So I wanted to delve into it a little bit, try to figure out what's going on with the pharmacy benefits. How are patients getting their medications? How is it influencing the pricing of what people are paying for their medications? So that's where the interest started with.
All right. So some definitions first before we go into your
Mhm.
article. What exactly is a pharmacy benefit company?
So pharmacy benefit companies or pharmacy benefit managers, PBCs or PBMs, are organizations that were originally set up to help patients navigate between the patients and the formulary, the medications they get. So they're supposed to help patients get access to their medications faster, right? They intervene between insurance companies and the medications that patients get, a middleman, if you will.
Sure. And in your world of fertility treatments, what are common medications that involve pharmacy benefit companies?
The most common ones are the most expensive ones. Your gonadotropins, we call them, the injectables like Gonal-F, Menopur, Follistim. Those are the key ones that are being regulated because they also happen to be the most expensive ones.
And just to give us some context, how many dollars are we talking about?
Oh, Lord have mercy. We're talking thousands of dollars, thousands. Medication for one cycle of treatment could easily run four, five, $6,000. So we're talking major bucks.
And tell me about your article. Tell me about how these pharmacy benefit companies are influencing the access to these drugs that your patients see.
So I think that one of the curiosity for me is to actually peel back the layers a little bit on these companies. What are they? What do they do? They're supposed to negotiate the prices for pharmacies from the companies that produce them, from the pharmacy, the industrial makers of them. They're also design the formulary that patients are allowed. They decide what medications goes on the formulary that patients are allowed to get. They also process the claims from pharmacy companies themselves, and they process the claim, how much let's say CVS or Rite Aid or whatever, how much they can charge. These companies decide that. And also sometimes they run their own specialty pharmacy companies. And the net effect of that is pricing can be in disarray. The end of that is that patients get a higher out-of-pocket portion.
So give us some examples of this disarray. So you mentioned that without insurance or without any coverage, these medicines
Mhm.
can cost thousands
Yes,
of dollars. So
yes.
typically, what are the out-of-pocket costs that people are paying for these drugs when managed by a pharmacy benefit company?
So if they decide what medication goes on, they decide what percentage of the medication cost is allocated to the patient.
Hmm.
So they can, and believe me, they're middlemen. They get profit from this.
Yes.
So to make more profit, they could simply allocate more of it to the patient. So sometimes patient may end up with a higher out-of-pocket cost.
Hmm.
Another thing is that they decide where you buy the medication from. Either you buy it directly from them or you buy it from their own network of pharmacy companies. Sometimes that's not always in the best interest of the patient. If the patient shop around, they may actually find out that a local Joe Schmo pharmacy down the road may actually provide the same medication for a lot lower than their so-called network pharmacy. So I always tell the patient, if you get a bill of say 6, 7, 8,000, you might want to shop around a little bit on your own.
Hmm.
You might find, even though they'll say, yeah, you have Insurance covers your medication. Your portion ends up being $6,000. Yeah, should it really be 6,000? Not all of them are like that. Not all of them, right? So I think patients need to shop around and check when you get a high bill, what portion can you get away with somewhere else? Another thing they don't tell patients is sometimes the medication is allocated under medical benefit versus your pharmacy benefit, right? So for patients, they're a little confused. You have to get your notebook down, write down and take notes and shop around to see how is it beneficial for you.
So on average, and I know that you
Mhm.
said that a lot of the prices were in disarray, what
Right.
percentage of these expensive medicines do these benefit companies typically cover? 50%,
So
60%? What's a typical percentage of what they would cover?
it might be 50% or so, but sometimes it depends on what contract they negotiate with the insurance company itself.
Mm-hmm.
So if they negotiate a lower percentage, then you're lucky. If they don't negotiate a better price, then you're out of luck. So it also sometimes they dictate what treatment the patients get. They may do what is called step therapy. So let's say an older patient who's 40, 41, who's about to run out of eggs. That patient, we may decide to be more aggressive and go to maybe IVF on her. They may say, no, we want you to do what is called step therapy. So you're going to do IUI, for instance. And if that doesn't work, then you'll do this and then you'll do that. Well, all those stepwise things delays treatment for patients.
Mm.
And sometimes you have to do what is called a peer-to-peer. So my go-to is I like to tell them, can I talk to your medical director? I need to explain why I'm doing this treatment so you understand the urgency that's involved.
And when you do peer to peer, how
Mhm.
much time does that take for you to do it? And how successful are you in overturning that decision?
I'm usually very successful because I can explain in a very rational manner why I'm using what medication at what time, right? But it does take time to get the medical director of whatever pharmacy benefit company is on the line. I have to sit around, wait for them. It does take time to sort of coordinate when I get to talk to them. So there is a delay in care while you're going through these hurdles, right? While you're going through one authorization after another. And sometimes the authorizations can take up to a week to 2 weeks before you get the authorization. And when you finally get the authorization, you can't necessarily go ahead with the treatment because you have to wait for a patient's menstrual cycle,
Mm-hmm.
right? Our treatments may be cyclical. So I can't just say, boom, I'm starting treatment. I may want to plan around the patient's menstrual cycle. In addition to that, I have to wait 2 weeks for the pharmacy benefit company. In addition to that, I have to wait some time to be able to coordinate speaking with their medical director. That's a lot of administrative burden on the physician side and a complete waste of time sometimes.
So, as a primary care physician,
Mhm.
sometimes, as you know, say with blood pressure, insurance companies and these pharmacy benefit companies, they may cover one thing and not another.
Yeah.
Now, when from a prescriber standpoint, do
Mhm.
these influence what you prescribe? Do you keep in the back of your mind, this patient has this pharmacy benefit company and I have to prescribe this? Does that ever influence what you prescribe the patient?
Yeah, sometimes it does. Sometimes it does. Sometimes you have to use a different medication or find something similar. Yeah, sometimes it does affect exactly what medication you use and when you use it. Yeah.
And you also wrote that not all pharmacy benefit companies specialize in fertility medication. There are some that
Right.
are more familiar with those type of medications than others, right?
Right, right. So you need a pharmacy that's more tailored to a fertility audience, right? So if they're not tailored to a fertility audience, you're having to teach them, no, I need to use this medication because this is the effect I'm looking for. And also, sometimes you do tailor a patient's therapy to fit them. All right. There, for instance, I'll give you an example. When you're doing a medicated cycle to transfer embryos back, some patients actually respond better when you stimulate them as if you're doing an IVF cycle.
Mm-hmm.
You have to tailor your treatment to whatever is good for the patient, right? So I have to be more careful with what's good for the patient. Well, I may not always get away with that because the insurance company may say, well, we want you to do this first. We're not going to approve treatment on you unless you do this first. And then you're allowed to go to the next phase. So they have considerable control over sometimes what type of treatment you do for the patient.
And just to be clear, can
Mhm.
patients change their pharmacy benefit manager, or is it dictated by whatever insurance they have?
For some insurance plans, it's dictated.
Mm-hmm.
It's not always flexible. They may say, well, this is the pharmacy that you have to use, period. You can't use anyone else. And if you don't like it, well, then, you're not getting the treatment from us, right? So they can be very regimental with what you do, with what treatment you give the patients. So I think that there needs to be more advocacy for broader coverage so that the patients and the physicians are not held hostage. There needs to be transparency. We need to know what goes on behind the doors. We need them to be able to tailor the formularies that they design for fertility care, not for primary care or for derm. Can you tailor it for fertility care? And can you give a broader range of medication so I don't have to use the exact one that you want me to use if it doesn't suit my patient? And then also, I think insurance companies should give the physicians the leeway and the ability to form their own partnerships with other specialty pharmacies that may have a better price,
Mm-hmm.
right? I don't have to be forced to use XYZ specialty pharmacy if ABC pharmacy can do the same thing at a better end price for my patients.
So you gave the example earlier about
Mm-hmm.
how prior authorizations can sometimes delay treatment. Has
Yes.
there ever been a really tragic patient outcome because of pharmacy benefit managers or companies that you've encountered in your career? Tell us a case study or an example of something that
Well,
really was
so
detrimental to the patient.
yeah, I think the most detrimental is sometimes we have patients who are like 40, 41, 42, and you see their ovarian count dripping right down and the AMH going low, and you're still in a battle with the pharmacy company.
Mm-hmm.
So in that case, I have taken to telling the patient, look, I need you to advocate for yourself. I need you to write a letter to your insurance company and say, look, you're delaying my treatment. If I become menopausal while you're still faddling around, then you're responsible for it. And when I do that, believe me, boom, that authorization comes out in seconds.
We're talking to Yemi Famuyiwa. She's a fertility specialist and founder of the Montgomery Fertility Center.
Correct.
Today's KevinMD article is The Hidden Impact of Pharmacy Benefit Companies on Fertility Treatments. Yemi, will end again, as always, with our
Yes.
take home messages to the KevinMD audience.
Take home message, be aware. Be aware, know what's going on. When you're starting your treatment, you need to know exactly what is covered, what is not covered, ask questions. And, ask them, can I shop around? Because when you tell them this matters to you, they actually listen better to the patients more than they do to the doctor's office.
Yemi, as always, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
Thank you. Thank you very much.